Good morning. My name is Randy Feathers. I'm a board member for Operation Our Town, and we're very pleased today to give you a great show on a very important topic. The topic is drugs and crime and how it impacts our Blair County community. We're very pleased to have a distinguished panel, which I'm going to introduce to you right now. To my immediate left is Judy Rosser. Judy has been in the field for 29 years. She's the executive director for the Blair County Drug and Alcohol. She's well respected statewide. I personally worked with Judy for a long time, and she's sort of a hero in our community, fighting the drug problem that needs to be fought. To her left is Detective Dusty Young. Dusty is a graduate of Mercyhurst College in Erie with a degree in police sciences. He served 3 years in the military, 25 years with the Altoona Police Department, and 9 years with the Attorney General's office. He was the head of the Altoona Police Narcotics Unit, and he's currently a detective in the Blair County District Attorney's Office. To Dusty's left is Attorney Peter J. Weeks. Mr. Weeks is a graduate of Pennsylvania University and the University of Pittsburgh Law School. He clerked in Lawrence County, Pennsylvania for Judge Pacone and Honorable Judge Michael Wary. And he's currently is the lead prosecutor in many of the drug cases in Blair County and has got record sentences for defendants out there with drug violations. To his left is Ashley Gehrdes. Ms. Gehrdes went to Penn State, Altoona for elementary education. She was a substitute teacher. She worked for Huntington County Children and Youth, and now she's with Blair County Children and Youth. And our last panel member is Cheryl Gonsman. She's also a graduate of Penn State University with a BS in elementary education. She has been with Blair County Family Services for 15 years. She's currently a community liaison officer, and she's a Leadership Blair County graduate, which I'm sure Pete and Ashley are also currently in Leadership Blair County. We're also with us today a group of 17 students from the YTI Criminal Justice Group, and we're very pleased to have them today, and they're going to be asking some questions of our panel members. So with that, we're ready to go. First question, please.
My name is Frank. My first question is for Dusty Rhodes. What type of drugs are the biggest problem in this area?
In the Altoona Blair County area right now, I would say the biggest problem, heroin. Marijuana is still a problem, but mostly heroin. Reason being, it is just so cheap now for the people to purchase, and it's so addicting that once you get on the heroin, there's just such a demand for the people to continue to purchase the heroin.
When you first started your career, was heroin the main drug?
No, it was not. It was cocaine. And prescription pills after the cocaine. I think that's where the heroin epidemic began. Is there was a lot of physicians prescribing a lot of pain pills back in the 90s, and then eventually the physicians tightened their belt a little bit, and then heroin has just been out of control since then.
Okay, next question.
My name is Christopher Ola. My question is also for Dusty. What impact has drugs been in the Blair County families that you've seen personally?
That I've seen personally? Well, the first example was my hair used to be jet black. I've been in the narcotics for about 25 years. It causes a lot of stress for not only the people involved in the enforcement, but for the families also. Families that have addicted persons, whether it be a child or a husband or a wife, not only is that person affected, the entire family is affected, the siblings, the children, and the immediate families. It takes a terrible effect because when the person's addicted to the drugs, they care about nothing but purchasing drugs. All other matters are forgotten, whether it's to pay the mortgage, get food for their children. It's just a terrible situation.
I know as a law enforcement officer detective that we have a lot of drug overdose deaths. Tell me a little bit about how that has affected you personally.
overdose drugs is, there's been a lot of overdose drugs, and it has affected me personally in several ways, some of which I won't elaborate totally. I don't know where you were going with that question. However, it takes a toll. It's a situation where, you know, it affects these families, and it's a situation that they have to live with the rest of their lives, in that, you know, somebody actually, you know, passes away. I'm very satisfied with this new drug that they have out, which Narcan, that helps people when they're in an overdose situation survive potential overdoses.
Well, I was going with that is, have you been able to, had to give death notification to parents and those things?
Yeah, I didn't know where you were going on that, sir. Yes, it is a tough situation when you have to let parents, you know, they aren't supposed to bury their children, as you well know, and it is a tough situation. It's a job that nobody wants to do.
Next question.
My name's Carly. My question's also for Dusty. What actions are being taken against out-of-towners bringing drugs into the area, and have they been effective?
That's a good question. To be politically correct, we treat all drug dealers the same. We try to get maximum punishments. But to be honest with you, the out-of-town drug dealers are the major problem in Blair County. They're the people that are coming in with the drugs to make a profit. They're not here to satisfy their needs. They're bringing the drugs in to make money. And we try to get the maximum sentences. Pete does a great job in getting large sentences against these defendants. Our hands have been tied here recently with the removal of the mandatory sentences. However, our judges are still trying to assist us in punishing these people who come in just for the sheer purpose of making a profit selling drugs to our people.
Now, I see you've had statewide experience with drug investigations. How does Blair County different than other counties?
Blair County is very similar to other counties. I've worked in the Williamsport area, also Cambria. I've found that all counties have drug problems. Our particular community has a sensational appetite for heroin and the pain medication. I don't know what it is, but our society is more into the heroin and the drugs that have kind of slow your body down, so to speak. Cocaine is more of a stimulant. Heroin and the pain pills are more a depressant.
Okay. Next question.
Shania, this is for Dusty also. How has recent negative public perception of law enforcement affected local law enforcement?
It's affected us in numerous ways. Obviously, the general people are not fond of the police right now. Consequently, they are not as eager to provide us with information. In fighting drugs, we rely on the public to assist us with their eyes and what they see and provide us with information many times. And we found that we're receiving much less information from the general public now because people are very dissatisfied with, unfortunately, some people in law enforcement in other areas and in our own area.
Next question.
My name is Crystal. I have a question for Cheryl. Can you provide an example of a success story of a child or family that has overcome an abusive situation?
I can't really give a detailed example just because of protecting the people that we do help. And it's really also very hard to gauge something as success because with domestic violence, it's a repeat process. They leave and go back. I think, you know, when I first started doing this, the average time a woman would leave and go back was 7, and now the national average is 11. And I think a lot of things factor into that now, most importantly being the social economic environment that we're living in. But to give you an example, for me, success is the first time they leave, is recognizing that there's an issue and that it needs to end, and they're at least taking the steps to get out of that situation. And when they come to us, and we work with them and talk to them. We give them the education that they need about domestic violence. So just the fact that they're coming to get the education about domestic violence, to me, is a success, and they take it back with them. But we've had a very good, I guess we could call it success, of the number of women who leave and don't go back. So they establish their own place, and they end up staying out of that relationship. But the other issue that we have is if there's a domestic violence situation or domestic violence in the family and there's children, it's very hard to leave because the children are always used as a tool. So just the fact that they're taking the step to learn more about it and try to get out of it, to us, is a success.
Cheryl, how much does drug impact families?
It has a significant impact. We have, the biggest thing that we've seen is the number of grandparents who are coming to us and seeking protection from abuse orders for their grandchildren. We've seen a significant increase in that. We've seen grandparents who have had to use our services because of their grandchildren as well, whether it's sheltering or we provide clothing and some food assistance and referrals. So we've seen a significant increase.
The majority of those cases are drug related.
Yes.
Okay. Next question.
This question's for Mr. Peter Weeks. Have you seen any decrease in any specific type of crime over the past 5 years?
Well, I would say that, as Detective Young pointed out, back in June of 2013, the United States Supreme Court changed the way mandatory minimum sentences were applied throughout the country. The Pennsylvania court system has taken that a step further and have declared the vast majority of our mandatory sentences unconstitutional. Our legislature has yet to respond to that and have not brought the mandatories back in line. Since 2013, I would say I've seen an increase in drug crimes and crimes of violence, and I would attribute it to basically law enforcement's inability to get some of the sentences that we were able to get prior to that.
When you talk about mandatory sentences, Mr. Weeks, are we talking just drug mandatories?
No, the mandatory sentences in Pennsylvania that were affected are child abuse mandatories, sex crimes mandatories, mandatories for crimes committed with firearms, mandatories for drug offenses committed with firearms, all the drug mandatories with the exception of manufacturing methamphetamine. So the vast majority of mandatories for any crime have been swept off the table.
That's interesting, because when you think of mandatories, I think people kind of think drug mandatories, but obviously it impacts child abusers, violent cases, and all type of things. Next question.
My name's Paige. My question's for Dusty. About how many cases do you investigate a year?
This particular year being a transition year from the Attorney General's office to the District Attorney's office, I have not investigated as many as I usually do. However, back in the when I was working for the task force, and I started with the task force back in 1990 when it originated, I would work approximately 200 cases a year, and that would be probably 100 to 125 different defendants. This is by myself with the assistance of other task force members. And that was back in 1990. I believe now I work close with Sergeant Moser and other people with the Altoona Police Department Task Force. They're working possibly 250 cases a year, and that includes all drug cases: marijuana, cocaine, heroin, bath salts, etc.
I know Detective Young has probably investigated over 5,000 drug cases in his career. I know when I worked with him years ago, he probably made more felony arrests than anybody in Altoona police history, so he'd be the right guy to go to for the number of cases he's done and seen. With that, we're going to take a little break, and we'll be right back.
Operation Our Town's mission: facilitate partnerships between the community and business to fight drug use and crime through proven law enforcement, treatment, and prevention techniques.
Welcome back. Let's jump right back into the next question.
My name is Chris from YTI. This next question is for Judy. How does the rehabilitation process actually work?
Well, as far as somebody who enters into the system in our community, they can come through any of our outpatient treatment providers or through Blair Drug and Alcohol Partnership. And all it is they really just need to be ready to make that first step. They get a drug and alcohol assessment, and a level of care is determined by a professional who does that assessment. And from there, that professional then helps them get them to the next step. They coordinate the care. They contact the facility for the level that they've been assessed for, and then from there we get an admission date for them and get them right over.
Judy, what's the percentage of people that come from the judicial system?
Right now, probably about 75% of the assessments are coming through our judicial system, and that's because we've done a really good job partnering with them. Mm-hmm. The whole idea with substance abuse in our community is we're doing more and more outreach. We work really well with the systems. We have specialty courts that we work with. We work with the probation offices. We work with juvenile, and we work with children and youth. What we're trying to do now, we're expanding the folks that we've been trying to outreach to where they may see them first and try to get them before they get into trouble. We have 2 projects in our community that our office got a grant to provide screening and brief interventions and referral to treatment with our physicians. It's unbelievable, but our physicians only get about 3 or 4 hours of education on this disease, though it's the #1 health problem in our nation right now. And so what we've done is worked with 2 physician groups in our community, partnering for health services through Dr. Gates, and then Altoona family physicians, Dr. Beckstead, have been really good about getting their physicians trained on how to do that screening and having a process in their office where they actually screen for drugs and alcohol, because if they're not treating that issue, the medical issues don't go away either, because they all interplay. It's a medical condition that will impact on medications they're prescribing and on the other diseases that they're treating them for. So we've been doing that. We are also working now with the emergency room and the medical facility at our largest hospital here, where we're working with the caseworkers. So when someone does come in with an overdose, for example, and ends up on the medical unit, that they can call us and we'll go right in and try to get that process started with them and meet with them. So we're really trying to do more outreach so we can capture more people to come in and get them earlier in this process of the disease.
Thank you. Ashley, we're talking about a lot about overdoses. How does that impact your agency?
Well, I don't have any statistics on me about how many families we've had that have overdosed, but we have had several in the past. Parents who've died. We've had some children be at the home at that time. So obviously that, if there's no other appropriate caregivers, then it's leading to placement.
What do you do in a situation, which I know this happens in our community, unfortunately, where you have a newborn, new mother, and she's still addicted to heroin?
Well, in December of last year, we actually created a casework position, and her title is she's fetal alcohol syndrome and drug addicted infants. Mm-hmm. Her whole caseload is just babies that were born addicted to substances, and she works with that mother and the family to really link them to services like Blair County Drug and Alcohol, mm-hmm. to really get her help that she needs to maintain sobriety. And the infant oftentimes remains in the hospital until they are cleared to leave. They're usually prescribed some kind of medication to withdraw them.
And the child goes home with the mother?
It depends on the situation and the level, the drugs that they were using, what the family home situation is like, if there's an appropriate caregiver. To date, since that position has been put into place, I don't believe we've had any placements, any formal placements, but they have put in safety plans, which is a voluntary agreement that lasts up to 60 days, where the child may go with a grandmother or another person may come in the home to help supervise.
Judy, I know that you and I worked on years ago with drug court. What do we do in a situation when we have a young, expected mother in drug court?
Well, the protocol for Pennsylvania and nationally, for anybody who's addicted to an opiate and becomes pregnant, rehab facilities cannot take them. They're not allowed. They actually have to be referred to a medicated assisted treatment, such as methadone. So those individuals are typically placed into a methadone program. And through the courts, though, we've had numerous babies being born and the parents doing very well with them. As long as they're on a methadone program, the situation that Ashley was talking about is kind of mitigated at that point because they are in treatment and they are receiving care. That doesn't mean the child doesn't have withdrawal symptoms from the methadone. They will, but it's much more stabilized because they're under the care. Most of these women wouldn't be getting prenatal care. They wouldn't be eating properly. They wouldn't be seen on a regular basis. And so through the specialty courts, it's really good because they do get seen, they get drug tested regularly, and they're engaged in treatment. So they're already starting to work on plans of how they're going to support this child when it's born.
Thank you. Next question.
Hi, my name's Rhett, and this question's for Ashley.
Say your name was Red?
Rhett.
Oh.
In your opinion, are there any programs that you would like to see changed or implemented in order to make CYS a more efficient entity?
What we really need is just community support. We can't solve all the problems within our agency by ourselves. We really need more mental health specialty places for people to go. I know when we're looking at families who are in crisis, there's multiple issues. It's more than just the drugs. There's also a huge mental health component to it. A lot of people have very traumatic incidents in their past. So that would be very helpful to us, is to have more trauma informed care in the county, and also safe places, more, we just not always small children. We often deal with teenagers who are in homes where the parents are using drugs or just being abused, and more providers that would take teenage youth. Certainly helping with the family services, we're in full support of getting a bigger teen shelter in the county.
Thank you. Next question.
Hi, my name's Logan Miller. Question for Judy or Alser. Has drug usage increased in juveniles in recent years?
Well, what we're seeing across the board in youth, as far as substance use, alcohol, which is considered a legal substance in our community, but our youth are using that at a high rate, much higher rate than any other substance. By their senior year, kids have already used. And why is that a concern? Is because 1 in 5 can move on to substance abuse that are starting at early age. The brain of a developing child, when you introduce any type of drug, whether it's nicotine, alcohol, or other substances, illegal, such as marijuana or any prescription drugs, which is kids are experimenting with them, you put it more high risk because that brain is developing. It's part of that disease process where the substance hits the brain, opens up those receptor sites, and then this child starts down this road. So it's a very high risk. So really we need to be not only looking at the illegal drugs that are out there, but we need to really be addressing some of the underage drinking issues in our community and the marijuana issue. It's a really big, what we're seeing with marijuana right now is because of what's going on nationally, and you guys are at this age where you're getting so many mixed messages about whether this is really a bad drug or not, and whether it should be legalized. And so that's really, the younger kids are hearing this. And we're having such a change in attitude around this that, when attitude goes down, use goes up with kids. So if there's an attitude of risk is going down, we're seeing use starting to go up on that. So it's a real risk for us.
Well, let's stay on the marijuana topic just for a minute. I know the state of Colorado is legalized, I believe. Mr. Weeks, do you have any comments in regards to that?
Well, two interesting things about that to me are this. Marijuana is still a Schedule I controlled substance federally, which means it's illegal everywhere. The federal government, through the Obama administration, has chosen not to enforce existing federal law in lieu of changing existing federal law. So in California, Oregon, Colorado, it's still illegal federally, and at any time the federal authorities could come in and make arrests and seizures based on federal law. Secondly, I had access to a report from Colorado studying the changes in crimes and medical events from first when marijuana was legalized for medical use, and then second where it was legalized for recreational use. And the increase in driving fatalities attributed to marijuana, overdoses attributable to marijuana have skyrocketed. There's abuses of public funds in Colorado where people are trying to use their EBT or welfare money to purchase the marijuana. They had to change the law about where ATMs could be placed. Another issue is that the purity of the marijuana has now gone through the roof because it's legalized in these places, and people are using marijuana the same way they used it when it wasn't pure, and it's creating sometimes drug-induced comas from the overdoses and hallucinations, a lot of unintended side effects. So it really is a problem.
Cheryl, what's your view on that as far as it impacts families?
It's significant. I think, we see, especially maybe even teens coming into using our teen shelters, we've seen not an increase in usage, but an increase of the teens coming in who are saying they're getting out of the house because their parents are using. So they don't even want to be in their own home because their parents are using. So we have seen that. We've seen, women and children coming to seek shelter service at our domestic violence shelter who they have to get away because they've been threatened. The drug itself isn't the cause for domestic violence. That's already there, but it lessens or increases the likelihood that it could happen. And so when it happens, it's more severe.
There's a financial impact on a family too, obviously.
Oh yes, we've seen a significant amount of people using our homeless shelter because one or the other.
Money.
Yes.
It impacts how people are employed, where they get a job, so it impacts the family financially too.
Yes.
Okay, we're going to take another short break, and we will be right back.
Most of the kids come from homes that are somewhat dysfunctional. A lot of times they don't have a parent at home that can help them with their homework. All they see is maybe the big brother who's been a drug addict. We have kids in the program actually whose parents have died from drug overdoses.
The human cost to our community is high. But drugs and crime also impact business.
Think about your own family. When my family goes out to shop and conduct commerce within the city or in the community in general, I think it's very, very important that we all have that peace of mind.
We're having a great discussion here this morning in regards to the drug and crime and how it impacts Blair County. We have a wonderful group from YTI Criminal Justice students with us today in the audience, and they're asking some great questions. And we're going to go to the next great question.
Hi, my name is Dwayne. I have a question for Ashley. What services does Blair County Children and Youth provide?
Well, all of our services are geared toward really keeping the children in the home with their family safely. There's a lot of case management service and obviously ensuring child safety, but as part of that case management process, we link families to the services they need, whether that would be drug and alcohol counseling, just mental health counseling, family preservation, family reunification services. So it's a lot of case management.
Next question.
Hi, my name's Cody. I have a question for the entire panel. Earlier, Ashley mentioned that they need community support to help them with their program. Is there anything the community can do to battle against the drug influence in this area, or should we try to let it in the hands of the professionals?
Let's start with Cheryl with that and work our way over.
I think your role's integral. I think we need to be looking at what keeps us as bystanders, and what is as a bystander, are we part of the solution or part of the problem? And I think being that first person to approach somebody in the arena of domestic violence, you'd be amazed at how much of a difference you would make just by going up to somebody and saying, you know, something doesn't seem right. Are you okay? It's not okay. The professional piece is more of where do we guide them to afterwards, but you don't need to be a professional to let somebody know you care about them. I think that's part of the problem is we don't let people know that we really care about them. And when you take that initial step to let them know that you do, I think you would be amazed at a big difference that you would make. So I think you need to stop being bystanders and start being upstanders.
Ashley?
Mine would be similar, you know, not being accusatory, not blaming people, really, you know, accepting them for who they are. A lot of times we have people being turned away for housing. Landlords don't want to rent to them. Oh, you're involved with children and youth, or oh, you may have a previous drug charge. And they could be in treatment and really trying to better themselves, but not being judgmental. I think, you know, the community as a whole being open-minded and really trying to help these people is how we can move forward together.
Judy, let me jump over to you on that because that's something that you and I have discussed in length before. Is our community a forgiving community as far as treatment people?
As far as regarding our treatment programs,
Yes.
I think they're getting better. I believe they're starting to understand that they're part of the solution and what we have. And really, there's still folks out there. The problem is we're angry at these people. We want them to stop this bad behavior they're doing. But unfortunately, this is a medical condition. And it's really understanding the disease, encouraging families. Families feel very isolated. So if you know a family that's going through this, helping them, guide them to help. Because the family needs just as much help as that individual does. And sometimes getting the family help helps them really start putting boundaries in place and allow the natural consequences of that addiction to start happening. Because we know with motivation to change, unless that individual starts feeling some consequences that are negative, they're not going to change because they are driven by this addiction. And with opiates, it's a very powerful physical addiction that they're driven, like Dusty was talking about, to use on a regular basis throughout the day, and that takes a lot of energy to do. The other thing with family, you know, what people can do in our community, because I believe they're the front lines. They're the eyes and the ears on the street. We have the Push Out the Pusher hotline to report drug activity. That is so powerful as a community watch type of activity folks can do when they're seeing something going on in their neighborhood and they believe that they may have a drug house, to report that anonymously to the police officers. They need your eyes out there. They need your voice. The other piece on that also is families need to understand that these opiate medications that are being prescribed for pain are very powerful and very desirable for those that are addicted to opiates. So if you have a medication that you've been prescribed, lock it up. Know how many you have. Don't leave it in your purse. That's one of the largest diversion areas, is purse or medicine cabinet. If somebody, you may not be aware that your grandchild or your child may be going down this road, but if you're seeing medication missing, that's a good eye-opener for you. So keep it locked up, and we're doing a lot of campaigns around how to secure your medication. The other thing is, if you don't need this medication, get rid of it. We have 3 lock boxes in our community. One at Tyrone Police Department. The Altoona Police Department is open 24 hours. Tyrone's only open during their hours during the day, and Hollidaysburg is open during their hours during the day. So use them. Get rid of these old medications. Get them off the shelf and off the street. It's very important. Those are real doable things people can do around this issue.
Well, as an old cop, you said consequences, and that got my attention. Pete, I know Blair County has a history and have a reputation of being very tough on crime and drugs in particular. Consequences, let's talk about that.
Do you mean in terms of the community being involved or consequences in general?
Consequences in general. If somebody, we don't slap people on the wrist that deal drugs, so to speak.
I've always thought that's important. That's one of the reasons that I enjoy working in Blair County so much. We have become a nation of tolerance, and that tolerance has basically led to making excuses for all types of criminal behavior. And the only way to change society, I believe, and to better the community, is to be intolerant of these types of criminal behaviors, whether it be drug trafficking, drug use, crimes of violence that's spurned from people trying to get drugs or people trying to protect their drug dealing business, property crimes. is to hold people accountable. So if you keep making excuses for people, or if you keep giving them third, fourth, fifth, and sixth chances, and that sounds funny, but there are people through the system who have 9 prior drug trafficking offenses and from other states or other areas and have never done significant jail time. People who have done, committed robberies or serious crimes of violence and never done serious criminal history. At some point, I firmly believe you should be removed from society permanently.
Dusty, what can law enforcement, what could we be doing better to fight this drugs?
Well, we need to cooperate with one another. A lot of times the different agencies refuse to share information, which is a hindrance to our investigations. Also, Judy took some of my thunder. We need the public to use the hotline. Believe me, every call's anonymous. If you don't want to be identified, you will not be identified. But we need that information. We cannot be everywhere. And we do follow up on the information you give us. But I think the biggest thing with law enforcement in general is we have to cooperate with one another. That's our biggest problem, is we want to be the agency to make the big arrest, and we're not going to let anybody else know. The bad guys win when we don't cooperate with one another.
Also, Dusty, I think over the years we've seen a change in law enforcement's attitude. I can remember when I was a young cop with hair, by the way, we thought we could arrest ourselves out of the problem, but now I think we understand the education and the treatment aspect of it.
Well, I personally understand treatment. Originally, yeah, we thought we could just arrest everybody and that would solve the problem. That wasn't solving the problem. We need, obviously, arrests are necessary, and Pete indicates that, these people have sold drugs 6, 7, 8 times. They need to go to jail and be put off the street. But other people, there are people out there selling drugs just to support their own habit. These people need to be rehabilitated, or they'll get back out of jail and continue to sell.
Next question.
Hi, my name is Chris. My question is also for the entire panel. With all the services and programs that are out there, we're on day 165 of the state budget. How's that having an effect on anything that we're trying to get done?
Well, I think let's start with Judy, because I think that's going to impact her the most.
It is a very significant issue. This has been unprecedented in our state and nationally. To have a budget go this long, that what we've seen in the past is the governor has approved a budget, but line item vetoes so money could flow. We're not getting any funds, and our safety net is starting to deteriorate. We're looking at, by the end of December, facilities closing down that help support individuals that are out there trying to recover from this situation, and that are also supportive of other issues like we have down here with children and youth and family services, our domestic violence, our shelter care. Those are all our safety nets in our community, and there's no resources coming in right now. It is a very significant problem, and we need to be talking to our to educate folks on what's going on, especially those that are down in Harrisburg.
Cheryl or Ashley?
We're seeing it's impacting us in a significant way. We are fortunately at this time blessed to be situated financially the way we are. We try to be good stewards with our revenue that does come in, but unfortunately our sister shelters are closing. Huntington County closed, so we're bringing individuals into our shelter from Huntington County. So we're watching these other shelters go down, and it's one thing for us to go ahead and say, yes, we'll take those people from Huntington, but if they're trying to establish a location where they're going to live or work, how feasible is that? So I'm seeing people who are not using the shelters not coming to our shelter because it's not good for them to be coming to our shelters. So we're going to see, I think it's going to get bad.
Ashley?
For us right now, the caseworkers, everything, we're still operating through the county, but a lot of the services that we make referrals to are running out of money. A lot of them are using personal loans and stuff just to stay afloat, or not paying the bills, and certain things right now are holding off. So a lot of that is what we're seeing. I'm concerned that we're having these families, we're making referrals to help them, and they're not going to be there.
Good question. Next question.
Very good question.
Hi, my name's Jess, and my question's for Judy. What are the signs of drug use to look for?
Well, it depends on what age we're looking at. For youth, some of the things, it's hard because teens go through some real changes and chemical changes, and they cause them to be moody and stuff like that. So what's regular teen stuff that's going on, and what's going on that could be drug use or alcohol use? Well, one thing is with alcohol, most families, if there's alcohol abuse going on, they're going to pick up on that typically. But what you want to be looking for are signs of disengagement from activities that usually were important to them, maybe some isolation, keeping secrets, not sure where they're at. If a family doesn't have good boundaries in place of, when there's curfews and stuff, coming in late, they may see that. They may see grades dropping, changing of friends. So for adolescents, families, it depends on how engaged you are with your youth and what's going on with them. You'll be able to see some of those trends going on. Moodiness. Again, that can be regular teen stuff going on, but is it significant? Is it constant, and is it long-term? Has this been going on for a while? For young adults, and what we see with parents who come into our support group, HOPE, is we see a lot of them talking about lying, manipulation, giving them guilt, feeling of guilt, that it's always somebody else's fault that something's going on, asking for money, continually needing money, not being able to hold a job. Those all are significant issues. And then eventually, as legal stuff starts happening, then it becomes really apparent that there's something really serious going on. So don't ignore, if you start seeing those symptoms, that maybe something's going on.
Okay, we're going to take one last break, and we'll be back.
Gloria Gates Memorial Foundation, our main goal is to try to break the cycle of poverty. And in order to do that, we have to address the factors that are involved in poverty.
Because of strong financial support from area business and an energized effort from citizens in our community, Operation Our Town has made a positive impact in our neighborhoods.
I've seen the results. That just made it a no-brainer as far as me wanting to be involved and involving our business in it as well.
A lot has been accomplished, but is the fight over? Of course not.
If we didn't have an Operation Our Town, then some of these programs wouldn't exist. Really, it helps change some lives.
Welcome back, everybody. Let's just keep rolling with the questions. Next question.
Hi, my name's Alicia, and my question is for Dusty. How frequently are you seeing new drugs being introduced to the Blair County area?
We see drugs, infrequently new drugs. However, our community usually lags behind the nation, so to speak, in that if there's a new drug that comes from, like meth, amphetamine, when it first came out, started out west and it migrated here eventually. And we do see the one-pot meth labs in our community now. But again, we don't see new drugs quite frequently. The one thing we are seeing here recently that's concerning us is bath salts is making a return, so to speak. And the problem with the bath salts investigations, the people are so messed up, we're having a hard time actually working with them to try to get investigations going. And it's so easy to purchase this bath salts. You get online through the internet, you order it, it comes to your house. It's very hard to investigate these cases. And that would be about the one particular drug that's new to our community right now.
Well, the people that are using bath salt, are they dangerous to first responders?
Very dangerous because they're out of control. They don't know what they're doing half the time. There's been reports of these people found nude in alleys. They just lose all control of what they're doing. Plus they're violent. They don't want to be taken into custody. It's one of the more dangerous drugs for being under the influence for law enforcement to deal with.
Mm-hmm. Pete, on the legal side, there's been some changes in regards to bath salt.
Well, I would group bath salts with synthetic cannabinoids. Since 2010, 2011, Blair County has had an influx of both bath salts, which is synthetic crack cocaine or synthetic methamphetamine, and synthetic cannabinoids or synthetic marijuana. The reason they're hard to prosecute is the word synthetic just means that the chemists out there making these drugs are trying to make them so that they don't fall under the regularly scheduled list of controlled substances. there is a catch-all that we can prosecute in Pennsylvania called designer drug, but we have to prove specific things. One of the things we have to prove is that the substance is intended for human consumption. It's very easy to prove that against a person using the drug, very difficult to prove that against the store or website that is selling the drug, because they always say that it's not for human consumption, even though that's why they're selling it. As you point out, Randy, I believe it was in the fall of 2011, the legislature passed the first round of changes to the controlled substances schedule list in Pennsylvania, making the synthetic drugs at that time all controlled. What the chemists did is immediately change the compounds. So they had to amend that, I think, 2 other times since 2011. So right now it's kind of a cat and mouse game between the legislature trying to keep up to date with what the chemists are doing. So we're still a lot of times operating in the dark, having to send the drugs out to private labs. We don't know what we're getting when we call it bath salts. Sometimes they're controlled and sometimes they fall under the designer drug.
Good question. Next question.
Hi, my name's Carly and my question's for Dusty. How long does it normally take to put together like a large-scale drug bust?
Well, it depends on the particular investigation. You're saying a large-scale investigation. If you mean a drug raid, they take months to get together. But as for a search warrant on a particular house, it could fall into place within days. With the right information, you get a couple people indicating that they can buy drugs from a particular person. We'll make a couple buys, and if we know this particular location is dangerous or the person is a target that we are very definitely interested in, we could turn around and make that do that search warrant within a week or so. A lot of times it just depends on the circumstances of the investigation, but to answer your question, it could be very quick or it could take months sometimes to do a large investigation.
Pete, is Blair County, have they been active in electronic surveillances, grand jury type cases?
We have. I think the last large grand jury case that was done in Blair County on a Blair County drug operation was back in 2011. That particular case, there was a local bar where the drugs were being funneled out of, and the way the bar was physically set up, it was impossible for law enforcement to determine where the drugs were coming from. There were apartments above the bar. The only way to get to the apartments was really through the bar or through a locked outside door. So in that case, the task force, I think, utilized the assistance of, and task force, when I say task force, I mean the Pennsylvania Office of Attorney General works with local police officers here in Blair County, and they used, with the help of Baltimore police and the state police, electronic surveillance using video cameras. There was a helicopter used, intercepts of phones were used, and that was an investigation that probably took in total, I want to say, about 1.5 years.
Next question.
My name is Christopher Ola. This is for the entire panel. Being criminal justice students, how is the criminal justice field changing that's going to affect us when we graduate and join the workforce as far as qualifications in y'all's areas?
Let's start with Dusty, some technology. I mean, you're an older, respectfully an older gentleman.
Well, things have changed a lot. Obviously, to some of the qualifications you need to become Act 120 certified. That's an academy, and most police departments will not hire you until you get that certification, which is like a 6-month training period offered several parts of the state. You need to get that, but you also need education. You need to be more than a high school graduate. College is helpful. Obviously, the school you're attending is helpful. These things will help you better address the situations that you'll be dealing with and stuff. The criminals are smarter and more savvy every year, and we have to stay on top of the technology, the things that they're using. So education is very important.
Next question.
Hi, my name's Cody. This is another question for the entire panel. The general misconception by the public is that drugs and crime is a main problem in the larger cities such as Pittsburgh, Philadelphia. How can we make it more apparent to the local community that the problem is right here in Blair County?
Who wants to speak?
Cody, I think one of the big issues is that right now, for whatever reason, on a national scale, you have many key politicians and the media saying that drug trafficking is nonviolent, and that the solution for drug trafficking and drug use is simply to do rehabilitation and do totally away with incarceration. Well, as a prosecutor, there is the crossover is unreal. I would estimate that well over 90% of all the crimes in Blair County, if you take the DUIs out, and DUIs in and of themselves are a substance abuse problem, but I would say well over 90% of all the crimes that we prosecute have to do with drugs or substance abuse in some way, shape, or form, because typically your crimes, your property crimes, are occurring because of drug use. A lot of times, and other people on the panel can speak to this as well, if I handle at a lower level a domestic violence case, there's drug use going on in the relationship. Oftentimes violence breaks out because people are trying to obtain drugs. Oftentimes violence breaks out because people are trying to protect their drugs. My boss and I just prosecuted a homicide case last year where an individual came from New York. He was all of 19 years old, had already committed violent crimes in New York, came here with the express purpose of selling drugs, got mad at someone at a bar and ended up shooting and killing that person's brother. So the crossover is real. It's in places like Blair County because, as Randy pointed out earlier, and Dusty's pointed out, we have a high percentage of drug users in Blair County, so there is a high profit margin for drug distributors. So with that intersection, there's a lot of violence that goes with the drugs and the other crime.
Judy?
Yeah, I would say for just the community, as far as them understanding that this can happen to anyone. Substance dependency, like I was saying earlier, with families, they need to, with children, be talking to their kids. They're the first line of prevention around this issue. We need to understand that this is an issue, and our community is not unique to other communities. We have this issue in our community, but we need to not take our head out of the sand and really start talking about it, and stop. There is some real negative aspects to substance use in our community, and that's what's looked at, but there are good things going on too. There are people that do recover. People do recover. I'm a person in long-term recovery. I have over 28 years of recovery, and I know that once you get on that road and you're working very hard, that is very important to our community, and those people give back to our community. But really it is about education and parents being aware and not minimizing when their children start to get engaged in alcohol use or tobacco use. That's serious. That's the start to this. This is where they really need to start to intervene if we're going to address it in our local community. And getting educated. If you do have somebody in your family that has a problem, you're not alone. There are support groups out there that they can come to and learn about this and learn how they can start putting boundaries in place that moves that person to get help.
Ashley, we've had a conversation here this morning about violence, about families, destruction of families. We often hear from people that drugs is a victimless crime. What would you say about that?
That's absolutely not true. Just like one of the other examples this morning, the neglect when parents are using, and that is all that consumes them. They're spending their money on that. They're not buying children their necessities. Those children are neglected. They're often raising themselves. Sometimes we hear them on the news, reports of the children wandering around Altoona on the sidewalks or outside in just diapers. That happens. Home conditions these kids are living in sometimes just deplorable. And it, again, there's mental health components, but the drug issue, it's not victimless because those kids are there. They may not, and they just can't help themselves.
Cheryl, in the families, briefly.
I'm gonna have to agree with what Ashley's saying. it affects each and every person. It affects your role as being a parent. It affects your role as being a child. You see children today who are acting like adults because they're left raising their siblings. That's devastating.
Thank you. With that, that's going to conclude our discussion today. I want to thank the wonderful audience we have from the YTI Criminal Justice field. It's a wonderful program they have back there. Our panel members, what struck me as we talked before the show and during the show is the interaction with all the different municipalities and different agencies and how law enforcement impacts children, youth, the families, drug and alcohol. I think Blair County is very lucky to have dedicated people like we have on the panel. We're lucky to have Operation Our Town to back these people up. And we're continuing to make Blair County a better place to live.